Trazodone is this old school antidepressant that it's not really used as an antidepressant nowadays because those high doses that will help with depression cause a lot of side effects. But at smaller doses, it can be used to help with people to fall asleep at night. It's usually prescribed anywhere between 25 milligrams to 150 milligrams at night to help with sleep. And when you get above the 150 milligrams, like when you get to 200, 300, that's really more of the antidepressant effect of this medication. People can take it about 30 minutes before they fall asleep, and it should help them fall asleep at night. And you can just take it as needed. You don't have to take it every day. So sleep medications are not my ideal go-to. I have another video about 5 ways to get a good night's sleep, and those sleep hygiene practices should be practiced first before starting a medication to help with sleep. But for many people, this is a good choice. And though, men in particular do have to watch out for this emergency side effect. In rare instances, it can cause a sustained erection that can last several hours. And the reason it's thought to be a concern is it could constrict the blood supply to the penis, causing dead tissue. And so it is a medical emergency. Often one needs to go to the emergency room, and it may require a urological procedure to get resolved. It's not common, but it is something concerning. The most common side effect with this medication is probably drowsiness or grogginess, not surprisingly because it's taken at night to help with sleep. But in cases where people may have unsteady gait or it drops their blood pressure, it can also lead to falls. So if one gets up at night from sleeping, they should be careful from getting from a sitting to standing position. They may need to gather themselves for a few seconds, make sure the room is not spinning, and make sure they don't fall or aren't unsteady on their feet. So trazodone in conjunction with other antidepressants or psychiatric medications can cause too much serotonin in the body, and this can lead to a rare condition, but serious condition called serotonin syndrome. And this is where one gets maybe very sweaty, diarrhea, flushing, dehydrated. Oftentimes I'll have to stop all of the psychiatric medications for a while, maybe even need to get hospitalized for a few days, get IV fluids. And so it doesn't happen often, although it is concerning enough and rare enough to warn people about.